Mediating our Q&A today will be Dr. Miles Sargent, the Executive Director of the Coalition and Partnerships Lead with Peach. And I'm now going to hand things off to Jocelyn Radcliffe, a member of the Canadian Association of Nurses for the Environment and the co-chair of the Ontario Nurses for the Environment Interest Group of the RNAO. And she'll be introducing today's topic and speakers. Take it away, Jocelyn.
Thanks so much, Autumn. Thank you to everybody who's joining us tonight to hear the stories of nurses involved in the area of health and the environment, who give their time and energy passionately to this area. And just wanted to celebrate all of the things that you do. So spreading the word and thanks to nurses out there in all the ways that you contribute to our health and well-being, in addition to this large way focusing in on the environment and health tonight. So we've already talked about some of the housekeeping items, and you can see some of our partners that are with us tonight below. And we've done a land acknowledgement too, and we encourage everyone to reflect on the places that they are from as well and what they bring to this webinar tonight. As you heard, we are recording. You have a means of asking questions. You can take them up as we go, or you can leave them until the end, and then we'll have a discussion after all of the panelists have had their chance to speak. Each panelist will have about 5 minutes to tell a little bit about their story and the ways that they're involved in this area. And then we'll have hopefully a good discussion. We can ask the nurses about their experiences and dig a little bit deeper into the things they've been involved with and the ways that they bring their passions to this field. And with that, we're ready to begin. We'll dive right in. I'm sure you're excited to meet the nurses that we have here today with us. And our first nurse, we can go to the next slide, perfect. Our first nurse is here, Fiona Hanley. Fiona is a nurse educator and an advocate for nursing leadership in the environment and climate and health from within the Canadian Nurses Association and the Canadian Association for Nurses for the Environment, also known as CANE. She continues to be an inspiring professor in college and university classrooms, as well as within conferences and webinars, and has co-authored foundational position papers on climate, health, and nursing. Unsurprisingly, she was recognized for her work in the Canadian Academy of Nursing Fellowship Nursing Fellowship Program. So join me in thanking Fiona for everything you've done and celebrating her tonight and hearing a little bit from her about the work that she's been doing. Off to you, Fiona.
Thank you so much, Jocelyn, for that really nice introduction. And so just to, I'm not actually working for the CNA, just to be clear, although I have had the pleasure of collaborating with them on a number of projects over time as well too. So maybe just to mention that I am in Montreal or Jojagi, which is a place where the Ganyangahaga or the Mohawk Nation are recognized as stewards of these traditional and unceded lands and waters. And so if you want to go to my slide, the next slide, somebody, I just thought I would mention 3 recent collaborations, and really the key word here is collaboration, because individually there's only so much one can do, but in collaboration really there's it's really exponential. And so these the 3 images reflect 3 recent collaborations that I've had the privilege of being involved in. And the one on the left, the radon gas, is a screening toolkit that I was really fortunate to be part of, a team that was led by Jack Avanti-Struss, who's the CANE president, and a really amazing nursing student, Casey Knowles, and as well as a professor of computer science at the University of Saint Boniface, Frédéric. And so in collaboration with Health Canada, who really approached us to try to help people understand, especially in the prenatal and early childhood period of life, the importance of understanding the health risks associated with radon. And so this was a toolkit that was developed, and I've put the link there that people that takes them directly to the toolkit itself. And it's really a very user-friendly little screening tool about radon, why we might be concerned about radon, what some of the health risks can be, and the importance of testing homes. So that was one project that we have developed in association with Health Canada. And we actually have a part 2 that we're going to be developing with Health Canada as well, also about radon. The upper right corner, the nursing toolkit for planetary health. This is a bit of a sneak peek of the cover page of a project that we have recently completed with the Canadian Federation of Nurses Unions. And this was a project the Canadian Federation of Nurses Unions produced a discussion paper in 2019 about climate change and nursing. But they really wanted, that was a really excellent position paper with great recommendations for nursing action, but they really wanted to have something much more practical in the hospital setting about what nurses could do to address climate change. And so we were able to assemble a really solid team of writers and advisors to tackle the creation of this toolkit, including Katie North, who will be speaking shortly. And so the toolkit is designed to offer guidance to the hospital-based nurse in learning about climate change impacts on health, how they might engage in climate action in direct patient care through the cycle of care, as well as at a more systems level, so making change at a unit level and also an institutional level. And it's really framed offering planetary health as the response to this very serious ecological crisis, the complex and multiple ecological crises we are facing, based on the new understanding of our dependency on and interconnection with the natural world. And it's going to be launched at the CFNU Congress in June. I've put the URLs which don't work yet, but they will be as soon as it's been launched after the 9th of June. And the other project that I just thought I would mention is that I've also had a huge privilege of working with a college here at CEGEP called John Abbott in the West Island of Montreal, in particular with a nurse called Alison Delig Ruiz, and we've worked together to fulfill a project of integrating climate change into undergraduate nursing education throughout the 3 years of the nursing program at John Abbott College. It's been a huge pleasure working with the nursing faculty there, and figuring out ways to try to integrate understandings about climate change, health, and nursing into their curriculum. And so that has been a year-long project that we've been really, I've really had such a huge privilege, and this is just really the start this year, and looking forward to where that takes us. So I think that's probably pretty well my 5 minutes. So thank you very much for this chance to mention these 3 projects.
Amazing. Thank you so much, Fiona. You've got some very exciting things on the go and some projects that you have worked within. Thanks for clarifying as well your role with the, I still think that qualifies as work, but it's a different type, of course. I'm going to get my video up and running soon, but I'm going to do this without it, I think. I'm going to introduce just our next speakers coming up. So we can change the next slide, please. All right, amazing. And our next speaker is Katie North, as I know her. Katie is a nurse educator and an advocate for nursing leadership and environment and climate. Sorry, I have gotten mixed up. Katie North is a registered nurse coming from Winnipeg, Manitoba, and has been nursing for more than a decade in many frontline positions and as a clinical resource nurse. She completed her master's in nursing and healthcare leadership at Athabasca before moving into the doctoral program at the University of Saskatchewan with a focus on in her research on the environment and the healthcare system. Today, she's a program team manager as well as a professor, in addition to her roles within CANE and the Manitoba Nurses for the Health and the Environment and more. So welcome, Katie, and a celebration of you as well and all the work that you've been doing.
Thank you so much. I'm really happy to be here tonight and share with everyone who has such similar vested interests in the environment and healthcare. If you'll just move to the next slide, I'll talk a little bit about my experiences so far. So I completed a master's degree in nursing with the University of Athabasca in 2021. And my master's focus was examining how a nurse-led change initiative could provoke meaningful change in tertiary care facilities. And I built off of 3 principles of Saber's model and developed a full nursing leadership model meant for environmental sustainability in healthcare. Moving forward with my studies, I'm now into my PhD with the University of Saskatchewan. My focus is still on environmental sustainability and stewardship in healthcare, and I will now be testing the applicability and validity of the model that I created for my master's project. So I will actually be doing a nurse-led environmental initiative with a tertiary care facility. This will be a mixed method study to evaluate the qualitative components of workplace culture, how employees and the organization itself feels about ecological initiatives, and taking the leap to really initiate some environmentally focused changes to their policies, practices, and products that are used within a facility, and to evaluate how they feel about a nurse being the head of such an important change within the organization. As for the quantitative aspects of the study, I will be doing a product exchange where we implement biodegradable plastic alternatives in the surgical area to replace the traditional plastics which are currently being used in the operating room. And there was such a mass amount of plastic pollution that was generated throughout the COVID-19 pandemic that there is absolutely a need for some change to be made on that front. And with the innovations with biodegradable plastic in recent years, this is a really attainable solution for tertiary care facilities. So that will be the next step in my project and in my studies, is to move forward and work on integrating these biodegradable plastics into our operating rooms. And then eventually I will be including a cost benefit analysis so that future organizations can determine if this is something that they can afford and if they would be willing to utilize long-term in the tertiary care setting. Some of the main contributors that I found through my research, again, plastic pollution, greenhouse gas emissions, and deforestation are what are contributing to major climate change and the global health emergency related to climate change. So my first main project for the PhD will focus on reducing plastic pollution created by healthcare organizations, and a secondary offshoot once I have completed my formal PhD research will be to continue to lobby for on-site composting systems and other ways to reduce reliance on fossil fuels for tertiary care facilities in developed nations. And that is basically a quick summary of what I'm doing and moving forward with nursing leadership and healthcare and environmental sustainability all in one.
Amazing, just on time. Thank you so much, Katie. It's just amazing to hear what you're up to and the potential impact that you might, that I expect you'll be able to have through that work. So thank you so much for sharing. We have next up, we have a nurse through, actually, let's go to the next slide first. Moving along quickly so we can hear from everyone. So we have Rob Samulack. He is the co-chair with me at the Ontario Nurses for the Environment Interest Group of the Registered Nurses Association of Ontario, or RNAO. And he's worked in many different areas, some of which he's going to speak about, so I won't give too much away, but from acute care to in the ER to rural and public health roles as well. And together we worked on multiple projects over the past year as we've been co-chairing together. And in that way, he's going to speak a little bit about ONEG as well. So I'll leave that up to him. So thank you, Rob, for everything that you've been doing, and I can't wait to hear more about it.
Thanks, Jocelyn. So mine is a little bit more personal, less research-based, but also about what ONEG is doing. So as stated, my name is Rob Samulack, and I'm a registered nurse, and I'm based in Ottawa. I'm currently a community visiting nurse with Care4. However, I wear many other hats as well. I'm a husband, father to 2 young boys. I'm a Cub Scouter with 101st Ottawa, a kids cross-country ski coach with Macrotalk Ski Club. And in these roles, I'm trying to teach kids to love and take care of nature while also being active and healthy. I do some municipal active transportation advocacy work with as the Bike Ottawa Ward 18 advocate. And today I'm talking to you in my role as co-chair of the Ontario Nurses for the Environment Interest Group of RNAO. So what led me to co-chairing ONEG? I had done some other roles before, but in the summer of 2021, Lytton, BC, it burned to the ground, much like what is happening today in Alberta. There were reports that over 800 people had died from heat-related injuries during the BC heat dome of that year. And in the previous 5 years, Ottawa had 2 once-in-a-century flooding events, as well as tornadoes. Ticks and Lyme disease were unheard of in my youth, but now they're rampant. Despite biking to school throughout my nursing degree, in 2021, I was biking to Smith Falls to work in a rural hospital, albeit I was driving a Prius, but I was still driving a lot. I was going through tons of single-use plastic PPE due to COVID outbreaks on my floor. On the weekends, we were going to a church camp, but a lot of people at the church camp are driving big trucks. I came to the realization in that summer that climate change was no longer a future probability, but it was now happening and society was only acting worse. I became really depressed and hopeless, and I found out later that that term is called eco-paralysis. I felt like the oddball, both in my family, in my rural hospital, and in my church community. I went for a walk with my pastor that summer, and we prayed about the situation. A couple weeks after that prayer, I received a newsletter from Arosha, which is a Christian environmental organization. And there was an opportunity to attend COP26 in Glasgow with the Christian Climate Observers Program. I applied to it and I was accepted. In CCOP, that program, I found people like me from all over the world, people who understand the link between faith and climate justice. Christians are supposed to serve and care for the vulnerable in our world, something that I'm trying to live out as a nurse. Climate change is affecting the world's most vulnerable first, as they cannot adapt as easily as the rich. As well, they live in areas that are most at risk to pollution, flooding, fires, famine, drought, and conflict. Most of the world's refugees are fleeing due to these things, which are directly caused by climate change or conflict over the root cause of climate change, which is fossil fuel resources. I came home full of hope that my actions and advocacy could change the world. I thought I was going to do something more in a Christian perspective, but I found the North American church was not really receptive to climate action, as well as other issues that are going on these days. However, by comparison, the nursing advocacy community was very receptive. The Registered Nurses Journal published an article that I wrote about a nurse at COP, Jocelyn, and then Hilda Swirsky, who is also from ONEG and Kane. They strongly encouraged me to run for co-chair in order to productively channel my advocacy energy. So what has ONEG done in the past year? Well, RNAO organized a debate for the provincial election, and ONEG influenced the focus of that debate to be on environmental determinants of health. We got RNAO to sign on to the Fossil Fuels Non-Proliferation Treaty. We wrote RNAO's submission for Bill 23, which is Doug Ford's Building Houses on Greenbelt bill. We participated in the Ontario Climate Emergency Campaign. We have hosted several speakers at our events, and like tonight, we have been speakers at events put on by other organizations. We've signed various petitions and collaborated or supported campaigns run by other organizations. We marched at COP15 in Montreal, Jocelyn, Fiona, and I. And then what is our plans for the future? This is my last paragraph, Jocelyn, I promise. RNAO has been provisionally accepted to observe COP28 in Dubai to represent Ontario nurses, to influence decision makers to take planetary health into their decisions. We have identified a gap in regulation that leads to huge amounts of pollution and single-use plastic waste that is produced by the Canadian healthcare system and is responsible for about 5% of Canada's greenhouse gas emissions, much of which Katie alluded to in her last presentation. We want to advocate to close that gap. This can be done by better regulating the supply chain. If our work is successful, it could have global implications, not only for the healthcare supply chain, but other supply chains as well. However, we need more hands to do this work. So if you want to join ONEG, please come. We could really use you. Come, we need more people. And that is my bit.
Thanks so much, Rob. I enjoy that plug at the end there. Wonderful. Thanks so much for telling us about what ONEG's up to and sharing your journey too. It's really meaningful to hear. We're going to hear from next 2 more nurses that are involved with ONEG. First, we have Olivia, and Olivia is a registered nurse that has worked within the ONEG executive for a number of years with a focus on policy and political action. She nurses in the field of psychiatric care and in areas of withdrawal management and forensic nursing as well. She has experience as well as a clinical instructor. She's going to speak a little bit more about some of the ways that she brings her passion for the environment and health into her work and in volunteer activities. So I'm going to leave that part to her. So welcome, Olivia, and thank you for the work that you've been doing.
Thanks for the introduction. I'm just checking again, everyone can hear me okay? Okay, my dollar store headphones I have little faith in. But as Jocelyn said, my background in nursing is almost entirely in different subspecialties of psychiatry. So in clinical education for students, again, mostly in psychiatry though. So I do have my specialty certification from the CNA as well in psychiatry. It's pretty well known that undergraduate programs aren't doing a great job at teaching anything about planetary health in their programs. I was quite shocked though how little is in the content for the CNA exam for psychiatry, especially given like some pretty well-known facts from the psychiatric field that SSRI antidepressants, that they can increase the risk of hyponatremia, and then some antipsychotics and anticholinergics can inhibit body sweating mechanisms, which in situations of extreme heat can be pretty dangerous.
We're not hearing you super well, Olivia. Don't worry, you get a little extra time to sort this out. I think when you come a little closer to your computer, we can hear that a bit better, it seems.
I'll give up on the headphones. So if you hear my dog or cat, is that a little better?
Yeah, that's way better. Thank you.
Okay. If you hear my animals, I apologize in advance. Sorry. So as I was saying, different classes of medication and psychiatry, they have a lot of impacts on the body and being able to thermoregulate, kind of in summary, as well as many illicit substances. They impair your judgment and perception, which makes it difficult to make decisions like it's hot, I should get out of the sun, as well as things like stimulants. You can imagine the physiological strain that they put on the respiratory and cardiovascular systems in the body, which in extreme temperatures can also be quite dangerous. This isn't even including individuals with mood disorders and primary psychotic illnesses, that they're struggling just with managing their perceptual disturbances, hallucinations, delusions. And so now trying to consider things like, I need to get out of the heat, I need to get out of the cold. A lot of them really struggle with that. So unsurprisingly, when I was team lead for the acute inpatient psychiatry unit in North Bay, in the summer, it's just a fact, you get tons of patients that go off ward on privileges and get terrible, terrible sunburns. In the winter, you get the reverse, where we get patients coming from the critical care unit transferred down with really awful cases of frostbite. I was speaking to a colleague of mine at the Sunnybrook burn unit as well, and they see the majority of their patients at the burn unit have substance use disorders or primary psychotic illnesses or have little housing available to them. So that being said, it's really shocking that this isn't promoted more in psychiatric fields, that this isn't taught more, especially with climate change. We're expecting to see more of the extreme heat and the extreme cold events, which makes this really important for our patient safety. So when I was on the acute inpatient psychiatry unit, I would try to make information boards for the patients kind of at a level they can understand as each season's kind of switch about different safety measures and different temperatures. And I would also send reminders to my whole staff team in the form of meetings, emails, and so forth about making sure you go after your patients to make sure they have sunscreen and do teaching with them. But with COVID, it really was not prioritized by management or staff. The burnout, shortages, and poor morale, just kind of the environmental safety concerns amongst that patient demographic, it was put on the back burner. Currently, I'm working in psychiatric rehabilitation. So this week, actually, I'm running a psychoeducational group with one of the rehab units on summer safety. Provided that goes well, I'm going to try to adapt it to perhaps our dual diagnosis unit or maybe our supportive rehab floor and see how that goes. I've also created a summer safety plan that I'm going to be using in all the transitional and discharge packages and sending it to their community agencies on things that they need to know in different areas that we discharge them to, because we cover the whole Northeast LHIN about different environmental dangers in their area. I'm also writing the orientation manual for the clinical transition RN position and hoping to include some planetary health information in that for whoever comes after me. From kind of more of a volunteer lens, it was already mentioned a couple of times that I'm with ONAG with policy and political action. I've collaborated on various projects. Rob did a great job of mentioning a bunch of them already. I also sit on the board of directors for my local conservation area, which would be Laurier Woods. I also perform the marsh monitoring program in that area with my husband through Birds Canada, where we see what amphibians and birds are out. I know, Jocelyn, I'm almost done. And then just kind of lastly, I hold a wildlife scientific collector's authorization permit for rearing monarchs through the Monarch Teacher Network of Canada. Just it's a special permit that lets me educate the public by rearing the monarchs. I haven't done so yet. I prefer to do education without doing that, but it is one thing I can look forward to doing with my husband this year, promoting more about the endangerment of that species. That's pretty much it for me. I'm sorry if my audio sucked.
No, that worked out really, really well. We got to hear, we also got to hear most of that really, really well. So thank you so much. It's really interesting to see how you've brought this lens into your practice day to day. It's amazing to hear, and how you're engaged in biodiversity work as well. I've learned a lot, even though I know we connect fairly regularly. It's been great to hear. Thanks, Olivia. And we have one more speaker left, everyone. So I'll switch to the next slide. Awesome. So Dominique also works within the ONIG, or the Ontario Nurses for the Environment Interest Group Executive, is a registered nurse, has been with us since 2020, and also focused on policy and political action. Dominique is a critical care nurse in Southwestern Ontario, and some of the roles in ONIG included organizing webinars, representing us within the broader RNAO, Registered Nurses Association of Ontario, and advocacy both like within our organization and also much more broadly within Ontario and beyond. Dominique also likes to spend outside, volunteers in her community garden, and likes to spend time cooking with food and spending time with friends, family, and a cat. So cats have come up a couple of times. Her cat named Leah. So thank you, Dominique, for all of the work that you've been doing in health and in the environment, and welcome. Can't wait to hear from you.
Thanks so much, Jocelyn. So cute. Yeah, I had to put Leia away in the bedroom because she was climbing on my computer. So she's just away for a minute, but I'll bring her back at some point. So yeah, hi guys, my name is Dominique. I'm a ICU nurse in Southwestern Ontario, and I work in the ICU. And I've just started there over the last year or so. So recently, like over the last few years, I've become more involved with our environment. Like as growing up, I wasn't really too involved, and my family wasn't too concerned, like, oh, it's fine, we'll use plastic wrap and plastic bags and everything and so forth. But I kind of like, as I graduated nursing, I kind of realized how important it is for not only us, but the environment and our patients and basically everyone and everything that lives on this planet. So once I joined ONEG, that kind of like sparked this cascade of ideas and events that kind of brought me to today. So I'll kind of get into a little bit of that. But A huge thing with Windsor specifically is that we've recently went through developing a new gas plant, which is just down the street from me, actually. So, as you know, like Windsor's a very big motor city, car manufacturer city. So they have a lot of energy needs, and they thought that by meeting these energy needs, we can build more gas plants instead of investing in renewable energy. So it was a capital power plant. It's a new 100 megawatt gas plant that they're implementing. And according to Ontario Clean Air Alliance, greenhouse gas pollutions from Ontario's gas-fired power plants will soar by more than 300% by 2030, and then by more than 700% by 2043. So obviously this can be very detrimental for the health of our planet and humans, and is going to throw us completely off track for meeting our clean energy goals. And this also ties into our 1.5 degrees Celsius goal. We're probably going to surpass that at some point, which is very sad. And then this is shifting us away too from electric vehicles and investing in that, because those companies who are creating electric vehicles don't want to invest in gas as well, energy. They want zero carbon electricity. So it's quite sad, but I think like I've been trying to like email our counselors in Windsor municipality and everything, and really not much has been done. But I was thinking the other day, and along Riverside, which is like a long stretch right on the river, there's a lot of apartment buildings and they have very flat roofs. And I was actually talking with a coworker about this the other day at work, and we're thinking like, oh my gosh, solar energy would be huge here and it would be great for us, because all these flat roofs and everything. And I don't know, I think that could be a huge like improvement in our city, just because it should be so much potential. It's just not really happening. And it's quite sad to hear, but I'm hoping to slowly just kind of move forward, send some more emails and email my MP and everything, and kind of get the ball rolling with that as well. I also volunteer in this community garden, like Jocelyn was mentioning, and they actually have a water irrigation system for the garden, and it's powered by solar energy. They have a little shed and it has a little solar panel on top of the roof. And I was like, if they can do it, then I'm sure the city of Windsor can do it as well. So something to think about. One other thing I want to talk about quickly too is just waste diversion from hospitals. So like Rob was talking about, and Katie was talking about too. So waste from hospitals is incredible. It's enormous. And there's so much that goes into landfills that shouldn't go into landfills essentially. So styrofoam cups, leftovers from patient meal trays, you name it, it all goes into the garbage. Unopened packages that were in isolation precaution rooms in the garbage, you know. It's quite sad. So we've started to get the ball rolling with ONEG to, thanks to Rob, with the supply chain campaign, and help reduce our hospital waste. It's going to be definitely a tough barrier to tackle, but I think we can do it. I think we can. And for example, like if we do a central line insertion in the ICU and we have all this packaging and everything, it fills up an entire garbage every single time, from the sterile drapes to the packaging. And we're talking about dressing tray procedures too. It's just so much waste. So I've actually recently emailed, like this morning, our president and CEO of the hospital to see if we can kind of incorporate more recycling bins and maybe a composting or food diversion program with the hospital to mitigate a lot of this waste and kind of just basically, just mitigate waste and remove stuff from our garbages that we don't need, because there's really no recycling bins throughout the hospital, like here and there maybe, but or even patient trays that if somebody's not hungry, they don't eat their food, it just goes back to the kitchen, gets tossed out. So quite sad. Just kind of ideas to think about. Jocelyn's got our video on there. So and that's all I got to talk about. But yeah, just some ideas and things I want to put out there. Thanks, guys.
That's so great. Thank you so much, Dominique. I really like how you drew attention to two super important issues, or more than that even, but energy at that scale of the broader impacts on all of our health and your community, and then also into the workplace too, which I think is so wonderful. So thank you for all of that. I'm so glad we have so much time we can discuss. Everything went so well. You also did so well at keeping your times to about 5 minutes. So thank you all, and thank you all for contributing your perspectives and bringing those unique passions and perspectives into your work and sharing the areas of your work, your lives that where you bring these passions into. So thank you for sharing. And now we've got some time to discuss. And I hope we have a couple of people who might have some questions brewing. And if not, I've got a couple of questions that I'd love to share. So let's start and take a look. We don't have questions yet, but we'll give you a minute or so to think. Feel free to add them in or raise your hand. I think that's an option. And you can
Jocelyn?
speak.
Yeah, Jocelyn, I'm never short of questions, so that won't be a
Perfect.
But no, thank you all for presenting. You were all amazing. That was great. And aside from Rob, you all stuck to 5 minutes. I think Rob was about 7. I'm just teasing Rob. I've seen Rob's full presentation, which was about an hour. So it's amazing. You got basically your life story down to 5 minutes. That was
Cut it all out. You said you wanted stories, right? So I was writing a story.
Yeah, no, that's true. Look, it was really interesting. I loved it. I actually was sort of, putting highlights of the main, recommendations for nursing action, a leadership model for environmental sustainability, climate justice and advocacy, education, around mental health and summer safety, and briefly mentioning the supply chain campaign, which of course I'm interested in, and volunteering for community gardens. So, I mean, such a breadth of things that are going on. And, hopefully we get this webinar out so lots of people see it. And I'll just warn you, what sometimes happens is we'll get an email saying, hey, can Katie tell us more, or can Olivia tell us more, right? And then you get to do the whole 45-minute thing. But for those watching who maybe aren't doing much or don't know what to do, it just shows all the various things going on and things that you can participate in. So it looks like we do have there. Hey, Mike, how you doing? To the nurses working in hospitals, have you been able to form a nurse-oriented green team?
I can kind of answer this a little bit. So with my coworker that I was actually talking with the other day, she's actually the first nurse that I spoke to, like in my unit, who was also super passionate about the environment. It was very nice to hear. And we had like 2-hour-long discussion about like things that we can do and things that are bugging us. And we were actually collectively going to kind of see if anybody else is on the same page to form kind of like a like a team, like a green team or something, and email our CEO president, but we haven't actually solidified it yet. So we're hoping to get there one day, but I don't know about Olivia or anybody else.
Well, for me, it's Katie speaking. For me, like I said, I'm testing, or will be testing soon, my model for the nurse-led ecological change initiative within a healthcare setting. And part of that model included developing a green team in a tertiary care facility. So I have already met with the chief nursing officer and the CEO of my hospital, and we are currently working on terms of order, terms of reference to create our green team. And we are planning to get that launched sometime in July. So it is possible.
And maybe I would also just mention that that part of the toolkit that we developed that I mentioned, the CFNU toolkit, which is going to be available on both the CFNU website and the CANE website. It'll be in digital form, so free for download. And there is a section also, I think Katie, you were one of the contributors to that section as well too, about
Yes.
how to form a green team in a hospital as well. So it gives very practical guidance to people about how to get that organized, and also what kind of how to decide what some of the priorities might be as well too, on what you might focus on, and even some examples of letters of how to formulate a letter to people who are the decision makers in your organization as well too, because of course that's a really important aspect as well too of organizing anything like that, is getting support from people at multiple different levels, and certainly including administration.
Also regarding that, so I did acute care nursing before I started community nursing, and I find in that setting, a lot of the materials that you work with in nursing, that is what you have to work with. You don't necessarily have a whole lot of choice when you're doing like IV insertion or a dressing change. This is the material you have, and it fills up a garbage can. So that's why I think we do have to look at the supply chain and how we can better regulate the supply chain so that we have the tools that nurses use, so that it can better empower us to do that. Additionally, as a nurse, you can talk to your procurement committee. I think Miles knows a little bit more about this, but there are ways to get involved with your hospital procurement to try to get more lower waste products. But we need to create some regulatory measures in order to make that more viable as well.
Mhm.
Thanks so much. Did anybody else want to add to that? Okay, great.
Well,
Somebody,
I could do a whole talk on it. So you really want me to go down?
I know, that's it, right?
Right.
More to
And,
come.
yeah, Mike is in that same procurement group too. So Mike has another question here. I see Fiona answer. I was actually going to ask the same question. A couple people mentioned
Sorry about that.
toolkits and well, I guess Katie, maybe you're still working on your project, but the leadership model for environmental sustainability. That would be interesting if you could send them to Autumn, if you have Autumn's address, we can see if there's a place to link those on the coalition website as well.
Yeah, certainly. My article with that model was published in December last year, so I can link the publication.
Okay, awesome. And I'm glad to hear there are things going on in you're in Winnipeg, correct?
Yes, I am in Winnipeg.
Yeah, that's great. And so which hospital are you at?
I'm at St. Boniface Hospital, our bilingual facility in Winnipeg. And I also teach at the Université St. Boniface.
Okay, and so they are open to your ideas. You said you met with the CEO.
Yeah, so I met with the CEO of the hospital, as well as the chief nursing officer, and they are on board to support a environmental sustainability committee. And after our meeting in March, they have now added environmental sustainability into the strategic priorities going forward. So that has been added to our official agenda for the hospital. And on a broader spectrum too, the Winnipeg Regional Health Authority, I've met with some of their executive as well to discuss ecological initiatives and large-scale capital planning. And we're currently working on creating an executive position for a nurse leader that would be responsible for ecological initiatives for the entire Winnipeg Regional Health Authority. And I selfishly am hoping to take that position, but I'm helping them to map out what it would entail at this point.
So you are what's known as a mover and shaker.
I like to cold call people that I don't know within the organization and talk about environment. And yeah,
No, you know what I mean, that's amazing. I tell people who are able to move the needle at their hospital that they've done 50 lifetimes of work in terms of your personal carbon footprint compared to what you can do at a hospital. I actually want to calculate that number, but it's massive. The impact a hospital has. Do you have any advice for people listening? How you manage to get up the chain to the CEO? That's not always easy to do.
Yeah, don't be shy. Firstly, like, you can't second guess yourself. If you have a really good idea and you want to push the environmental agenda and you can see the bigger picture, even if it's just for your organization or for your city, don't be afraid to reach out and make those connections. And sometimes all it takes is going one step higher on the chain, connecting with your direct program manager or the director of the program you work for, and they can put you in touch with the people who can make these types of big decisions. That would be my best advice for people looking to kind of do something similar.
Okay, that's awesome. And Fiona, do you want to speak to what you just typed in the Q&A here about your toolkit?
Sure. Sorry for preempting that. Sure. The question was about when the toolkit would be launched. So it will be launched on the 9th of June at the CFNU Congress that they're having, excuse me. And but the URL is already created, and it will be available on the CANE website, as well as if people are members of the CFNU, it will be also available on their website as well, in the digital version. And also, I think it's important to mention that it's going to be available both in English and in French. So it's important that it has accessibility to people across the country. So yeah, it will be available for anybody who is wanting to be able to use it. And we're really hoping that it is going to be something that can be. It's a very practically based tool. What can people do when they have patients? What are some of the things that they can think about in assessing their patients? Some of the questions that they might want to be asking in the context of climate change, or related to the particular risk that patient might have based on their age or where they might happen to live or their health condition. All the way through, some of the teaching that they might think about, right through to discharge and so forth. So we're really hoping that it is something that's going to be very practical and useful for nurses in the context of anywhere in the hospital and
Fiona,
elsewhere.
Fiona, would you mind spelling out the acronyms, CANE, CFNU, etc.?
Yes, sure. Okay, the Canadian Association of Nurses for the Environment, or l'Association canadienne des infirmières et infirmiers pour l'environnement, and CFNU is the Canadian Federation of Nurses Unions, which is the syndicat pour les infirmières canadiennes, infirmiers canadiennes. So those are what those acronyms are. Sorry.
That's great, thanks. We have a couple of minutes left if anyone has any questions, but I've got kind of like a question for everyone. But I was waiting until kind of to see if we have a couple other people who wanted to add something in from the audience. So put your hand up if you do.
Do I count, Josh?
Well, yeah, absolutely.
Well,
I think that everyone's interested to hear.
Last one. I just wanted to ask Olivia. She was talking about SSRIs, obviously mental health, summer safety. Interesting, because of course we may be seeing more SSRIs prescribed because of climate grief, climate anxiety. And Olivia, this maybe a bit of a tough question, but what do you recommend there?
Gosh, it's hard depending on the condition and stuff, because actually as well, I'm seeing a lot of like environmental based delusions, almost like you have religious delusions, grandiose, paranoid, and like a lot of them coming in now are about the environment, and they get kind of, twisted, warped, kind of out of proportion. But we're seeing a lot of that too. I know that broadly nature therapy is gaining more traction. So if people feel more connected, then kind of that I'm going to do something about it, like that action-based kind of therapy almost is good for some people. On more of a clinician perspective, I think that we need to acknowledge it more. I work with a lot of people that they're like, this isn't relevant to psychiatry, this isn't relevant to anything. And so when people have these concerns, they're almost, I hate to say belittled by some of the staff, but I think having more nature therapy, and then as well as staffing more educated to correctly address some of these concerns of patients. And then for discharge planning, being realistic, we cover some reserves that don't have clean water. They flood every spring, and how do we mitigate that?
Yeah. Okay, thanks.
Yeah, one piece actually that connects to is the nature prescription program. And I know like we've talked about that a little bit, Miles. Like I think I brought that up in one of our newsletters, just about this nature prescription program that has started out in BC and is really a program that gives access to Parks Canada locations, like actually a pass to go out to the park, which isn't always close to everybody. But the idea is, of course, that nature therapy is a real intervention that has a lot of evidence to support its the ways that it works for many different health conditions and circumstances. And 20 to 30 minutes reduces, evidence shows that that is enough to reduce your cortisol levels and reduce your stress. So really, I think what you're saying is really powerful and really speaks to that program. Also, nurses, anybody who's a registered professional can get a prescription pad through that program. So it might be something people are interested in. Maybe it's a conversation starter. Maybe it's something that you want to embed. Maybe you're close to a Parks Canada location. And it really could be something that could enable your patients to get closer to nature. So yeah, that's one thing that brought up. Thanks so much, Olivia. So my last question was just about kind of bring your passion forward, and actually really speaks to what you're speaking about, with like how sometimes you get bogged down, and Rob, you gave that story too, like about how you felt that eco paralysis and things aren't always easy. And I wanted to actually ask about what keeps you going, what keeps you passionate and moving forward in this work. Just to wrap us up, so maybe we can go, and maybe everyone's okay. If you have something to speak about there, I'll just go one by one. So maybe Olivia, you would want to start us off.
Oh my gosh. What keeps me going, I think for me, you have to have like a never-ending sense of curiosity and wonder about things. Learning about different species, biodiversity, ways to implement things in your practice. And I think if you have that, it helps with a positive outlook, but also helps with taking all these thoughts and trying to make like concrete action about things.
Thanks so much, Olivia. Rob, you're next on the list, and I wonder if you might want to speak to that.
There's a couple things that keep me going. One part is the doing action gives you something to do. So being part of this group with ONEG, it gives me something, like, rather than just sitting there feeling that I can't do anything, it gives me a little bit of agency to be able to go and do something. So it seems like the problem is so big, but by joining these collaborations and these groups, you can make a fairly big impact. The problem is really quite big. And another aspect that gets me through it is my faith. That gets me through parts of it as well. That there's hope that things will be all right things will be all right. So
Thanks so much, Rob. Fiona, what's your thought?
Well, I really like the idea of taking notice of nature and taking notice of the resilience of nature and appreciating it. For me, it's also collaboration. I think we have a really wonderful organization. Here we are all collaborating together on this today, all of these different groups together. I think that is really, really important. Being with others, I think that is really, really supportive, that you get the power and the energy from other people around you as well too, that help to inspire you and give you support for going forward.
Thanks so much, Fiona. I'm really feeling the good energy in this group. Thank you for recognizing, the power of all being together. Katie, what are your thoughts? What brings you up in this work?
Yes, similarly to everyone else's responses, it's being able to work collaboratively with other people who have a similar interest in environmental health and are coming from a healthcare perspective and a nursing lens more specifically. It's really opened doors just to find other people through networking who have a shared interest and brainstorm further ideas. I'm constantly seeing more and more streams and more directions that I can go with future research. And I think just being able to have those ideas in the back of my mind, sorry, my baby is here, has really helped to, keep me motivated to want to continue my work and research in environmental sustainability in healthcare.
That's amazing. Thanks so much, Katie. Dominique, your last up.
Thanks, Jocelyn. Yeah, I think similar to what Rob said, what Fiona was saying, just about having a sense of community and having groups and stuff that we can join and kind of work together. Because it's just being alone and trying to tackle everything all at once is definitely very overwhelming. So like ONEG and even my community garden that I'm volunteering in and my coworker at work, like all of that kind of really helps to kind of keep me motivated and moving forward.
Thanks so much. I am so enthusiastic about this that sometimes my words don't catch up with me. But I wanted just to say, I loved this opportunity to hear from all of you. I've loved how different each of your stories are and the ways that you bring your care for the environment and the health of our population together in your life. And I wanted to thank you so much. And on the note of collaboration too, I wanted to invite you all to check out our many different organizations. Maybe we can even go back to that first slide because it shows kind of all of the logos. Connect with us. Yep, I have my email address here too, and maybe I'll put that. Maybe you can take that down, and you can also see at the very beginning of the presentation in our promotions, you can see that we have the Cascades, we have Peach, we have the Coalition, ONEG is part of RNAO, and all of us would love to continue these conversations with you and to connect with you and just build each other up through that. So I just wanted to say thank you to everyone who has come tonight to join us for this celebration of nurses on the heels of Nursing Week last week, and to talk about these exciting and important issues. Thank you so much. And good night.
Thank you so much. Good night.
Thank you.
Thanks, everyone. Good night.
Thanks, everyone. Take care.